Hello and welcome. My name is Sean Simmons. I'm a physical therapist, and today we're going to be talking about shoulder impingement, which is one of the more common causes of shoulder pain. What exactly is shoulder impingement? Shoulder impingement is when the head of the humerus, or your shoulder bone, pushes up against your collarbone and squishes the material in between. And this is usually muscle, tendon, and bursa, which is just a fluid-filled sac that helps things glide better in that region. It's a very common cause of shoulder pain and occurs when, again, the impingement of the tendons or the bursa happens when the two bones come together and squish the contents. This can lead to inflammation of the rotator cuff tendons, which is called tendinitis, and this is generally the supraspinatus tendon, or the bursa, which is when you're told that you have shoulder bursitis. If left untreated, these can eventually lead to tears and bigger problems. But basically, it's just the soft tissue getting squished between two bones, and this commonly happens with repetitive motions and a lot of overhead activities, essentially when you're raising your arm over your head. The image on the left is showing you the supraspinatus muscle and where its tendon inserts. Notice how it goes between the two bones and can get pinched there. And then the picture on the right is just showing you another tissue, which is the biceps tendon, that can get pinched in that same area as well when you do a lot of overhead activities. It is very common. It's one of the leading causes of shoulder pain in the average population. It's very common in people that do a lot of repetitive activity, and especially repetitive activity overhead. So painting, like the guy in the picture, has both arms reaching overhead to paint the ceiling. People that do a lot of this, especially for a job, are at a much higher risk for developing shoulder impingement. Poor sustained posture, sitting at a computer with your shoulders hunched and your back curved, can also lead to pressure in the same structures and create shoulder impingement that way. I had a patient the other day that came in with shoulder impingement or shoulder pain after hanging paintings in a local art gallery that she volunteers at, and she spent most of the day reaching overhead trying to put these paintings on hooks that were above her head. And she did this enough times that it irritated the tissue, and now she has shoulder impingement or shoulder pain. The most common and obvious sign and symptom of shoulder impingement is shoulder pain. And in general, this is when you raise your shoulder over your head. There's a lot of people that have pain when they reach for their seatbelt, when they reach across their body and try and pull their seatbelt across. It's a common motion that'll irritate shoulder impingement. People also notice this when they're trying to sleep. If you sleep on your left side and your left side is where you're having the shoulder pain, the lying on that side will make it worse. In later stages of this, you can notice pain when you're just sitting there, doing nothing to your shoulder, and you'll also start noticing muscle weakness when trying to reach or lift things. The causes are generally pretty straightforward, and we've gone over them already. Any repeated overhead arm movements, such as painting, hanging pictures, tennis, baseball, swimming, can all eventually lead to shoulder impingement if there are any issues there. Occupations that require a lot of overhead lifting, again, the example with the pictures is a common cause, and then the two bottom pictures there are showing poor posture and what it can do. It can, over time, create a series of tightened muscles and stretched muscles, and again, put pressure on the rotator cuff, which eventually leads to pain. And then the last thing there is talking about low fitness and sedentary lifestyle. Again, if these rotator cuff muscles are weak, then this will predispose you to having shoulder impingement syndrome and pain resultant from it. Preventing it should be relatively easy. 1, avoid a lot of overhead activities. Make sure that your posture is good, and perform general shoulder strengthening exercises. Again, ideally under shoulder height. When in doubt, ask your local physical therapist. There are a massive amount of shoulder exercises that are considered good to do if you're trying to prevent injury. There's entire books full of exercises. The ones I'm showing you here are just your basic first go-to moves. You need to master these before moving on to anything more complicated. But like I said, there are hundreds of exercises that you can do to strengthen appropriate rotator cuff muscles to prevent potential shoulder impingement. Again, the big key is avoiding a lot of overhead activity, especially when you have weights in your hands. So again, military press and exercises like that are not my favorite and ones that I would suggest avoiding. This is a pretty common condition, so if you have a mild case of it, what do? You have the option of going to your physician, who will more than likely prescribe anti-inflammatories or suggest an injection depending on how much pain you're having and how much function it's actually restricting. The other option is physical therapy, and at this point, we would target very specific muscle groups after testing and evaluating your shoulder. And the picture here shows 4 common exercises. These are all good exercises to strengthen what we call scapular and shoulder stabilizer muscles. The idea with these is that you strengthen a certain group of muscles and it will relieve pressure in the area that you're having pain. Physical therapy is generally highly successful for shoulder impingement, especially when you get in at the beginning of the problem. Unfortunately, if you're like a lot of people, you've let it go for a long time and said, oh no, it'll get better. And unfortunately now it hasn't, and it's even gotten worse. So what are your options? Again, the physician with anti-inflammatories and injections is a common and usually successful option initially. Physical therapy tends to have more long-term benefit, and the combination of the two is ideal in my eyes. Physical therapy, again, would target specific muscle groups to strengthen and stretch, and you're more likely to get a more hands-on approach to address any motion limitations, and that's what the picture is showing. Again, physical therapy is highly successful in these cases, especially when combined with the treatment from your physician. Most exercises are going to be safe, especially if you avoid a lot of weighted overhead motions, like a military press is a bad idea in this situation. Most people do better if they start with light weights and ice it afterwards. There are certain range of motion and stretching activities that can be beneficial depending on what exactly is causing the impingement and the pain. And again, just in your general lifestyle, reducing or eliminating the activities that occur above shoulder height will be beneficial in the long run. Muscle groups commonly targeted with good exercise routines or physical therapy programs include the rotator cuff, lower and middle trapezius, and the serratus anterior. Exercise for general fitness should occur daily. Targeted specific exercises for your shoulder, especially when involving strengthening exercises, should occur no more frequently than every other day. And when you're starting out, that might even be once every 3rd day, depending on the level of symptoms and pain you're having. Thank you very much for watching. I hope this was a good brief overview for you on shoulder impingement and answered hopefully a few questions. If you have time, please check out my website at thesmartlifeseries.com or facebook.com/smartlifeseries. Thanks.